1 in 10 people suffer from kidney disease. They have the worst quality of life of any person with a chronic medical condition, and they're more likely to die from their kidney disease than prostate cancer, breast cancer, bowel cancer, road traffic accidents and suicide combined. Hello, my name is David Johnson. I work with the Australasian Kidney Trials Network, which is based in Princess Alexandra Hospital under the University of Queensland and Translational Research Institute in Brisbane, Australia. I and in fact most patients actually want to know how to live better with their disease than necessarily stop dying from it. They want to be able to still live useful lives, productive lives with their family, be an active part of society, and kidney disease prevents them from doing that. Over the last 20 years we have made significant efforts and progress in developing new treatments and new interventions that make a meaningful difference to the health and well-being of people with chronic kidney disease. With the IDEAL trial, we worked out the ideal time to start dialysis, which could be later than people thought, and now we're trying to work out how to start dialysis rather than, at the moment we start full dose, but now we're looking at whether you can get away with just a graduated start. So that frees up your time so you're not hung up attached to a machine all the time. We're also really interested in trying to free patients from being leashed to a hospital and be able to practice dialysis in the comfort of, and safety of their own home. And that's particularly important during this COVID era where social distancing actually makes it a risk for patients coming to hospital 3 times a week to have dialysis. So we are developing better strategies to help empower patients to be able to dialyse at home and do so effectively and safely. For people with polycystic kidney disease, we're developing a novel repurposed form of treatment, which is actually an old anti-diabetic drug which has a good track record in safety. But we found that it actually may be very effective in patients with polycystic kidney disease, offering them some hope of an effective treatment which currently they don't have. There's one other major international collaboration that we're doing. We're hoping to recruit 3,600 patients across Australia, New Zealand, the United Kingdom and Canada to look at whether a particular medication called a phosphate binder, which is currently used in standard practice throughout dialysis units all over the world, actually does what it's purported to do, which is reduce the risk of cardiovascular death and all-cause death. But what we have found is it contributes substantially to the pill burden. So many patients are taking 6 to 9 of tablets from this particular phosphate binder a day, and about half will actually get very serious gastrointestinal intolerance, including constipation, abdominal cramping and bloating. And we've already done a pilot trial which suggests that it may actually not be effective at all in counteracting cardiovascular disease. So I'm currently the global chair of that trial. And yeah, it's huge.